Developing nations bear a disproportionate amount of the world's health burden, particularly in the areas of communicable and preventable disease. The Comprehensive Rural Health Project, or CRHP, was developed to meet the needs of impoverished people in rural areas with little access to healthcare. CRHP was founded in the 1970s in Jamkhed, Maharashtra, by Drs. Raj and Mabel Aroli, and is today renowned in the public health arena, not only for its success in improving the health outcomes of the people it set out to serve, but also for its novel approach to healthcare. The project is centered around village health workers, originally underprivileged women from the untouchable class, who work within the villages to provide basic primary health care and health education based on preventing disease. Wow. The town of Buldana lies 500 kilometers east of Mumbai and is surrounded by a number of satellite villages. There are a number of problems that face the villages of Buldana on a daily basis, including poverty, malnutrition, and poor access to education. Women and girls in particular bear the highest burden of need. This girl explains how because of poverty, her family cannot afford to send her for higher education, and she must therefore stay at home to work on the farm. This girl describes how early child marriage is a big problem for adolescent girls in her village. Seeing these issues, it is strange to imagine that India is one of the fastest developing nations in the world. Is it possible for the cycle of poverty in rural India to be broken? The Community-Based Health Project, or CBHP, was founded by Dr. Moses Kharat, who grew up in Buldana and witnessed firsthand the adversities that the poor villagers faced. He was inspired by the success of CRHP Jamkhed and travelled there to train under Dr. Raj Aroli, with the ultimate goal of bringing a similar project back to his hometown, where he felt there was evident need.
When I used to see people suffering just because they are poor, just because their economical condition is not good, just because they are from a Dalit community or they are untouchables, they are deprived of the medical medical facilities. I wanted to do something for that.
CBHP intends to transform the villages in 3 stages. The first stage is to build rapport with the villagers, to understand what their needs are, and to form an enduring bond of trust between the villagers and CBHP. The second stage is the selection of village health workers, who will form the backbone of the program. The village health workers are special in that they have been selected by their own community to become the primary health carer for the villages. The third and final stage of the Community-Based Health Project is the training of the village health workers by Dr. Moses to bring basic primary healthcare and preventative healthcare principles to the villages. Supported by a small mobile health team headed by Dr. Moses, the village health workers play a pivotal role in transforming the villages from a grassroots level. Although there is a wonderful vision for the villages of Buldana, the Community-Based Health Project is still in its infancy. The project needs a sustainable source of income to fund the intended projects, including a long-term program to combat malnutrition, establishing supportive programs for adolescent girls, and also to provide kits containing basic medications for the village health workers. Dr. Moses is currently in pursuit of seed funds, which will be used to establish a nursing college in Buldana.
And so we need basic seed finance for this project so that we become self-sustained, we become self-sufficient and run this project further.
Dr. Moses is not alone in his efforts to improve the conditions for the villagers in Buldana. Over in Melbourne University, Australia, a medical student organisation known as Conceive is dedicated to promoting and improving global health. In collaboration with SIFE, or Students in Free Enterprise, a commerce-based student group, they have designed a volunteer program which has raised significant funds to put towards the nursing college and the community-based health project. Conceive has also conducted the first run of an annual health audit, which will assist Dr. Moses in identifying health issues in Buldana and monitor any improvements that the community-based health project enacts. But ultimately, this is about the villagers in Buldana. This is about empowering the local residents to take control over their own health and create a brighter future for themselves.
We would like to see as a project, as a CRHP, we would like to see that equity, integration and empowerment in the villages through our village health workers.